And you're on mute.
Thanks. So unfortunately, due to some delays in Polish Airlines schedule, I had to open this seminar from a bus going from Tallinn to Tartu, but I hope the wireless and everything will hold in between. So it's a great pleasure to welcome you all in our next webinar series of mental health acceleration. So the webinar is a collaborative effort by Tartu Biotechnology Park, Scanbalt, and Tartu City, and we are financed by EIT Health Research Program. And the aim of this program is to talk on the topics that are relevant for developing novel mental health innovative solutions, and to try and figure out what are the main aspects when we're talking about how to create better conditions for everyone and how to more sustainably support mental health innovation in the society and with the help of different stakeholders. So today we have with us Helen Kõpp. I hope, Helen, you are here and you can see and hear us well.
Yes, I can. Hello.
Excellent. Very nice to meet you. So it's a great pleasure to have you with us, and we invite you here today to talk about your personal experience. So of course, we can talk about different financing models and what the doctors think, and it's all very relevant, but it's also very important to know how people who have gone through a stressful period in their lives see things from their side. So it's a great pleasure that you are willing to open up your story and talk about what you have gone through. It's a very valuable experience for all of us. So please, the floor is yours, and I will, yes, shut my microphone now. Thank you.
And thank you. It's a pleasure to be here. And I'll start to share my slideshow soon. Hello, my name is Helen Kõpp. I am a medical student, first year in University of Tartu. Actually, I'm taking part from a competition where medical students write scientific papers in our journal for doctors. And my subject there is person-centered care, and my tutor is Dr. Eduard Maran. I have already written a small article in the website Meditsiiniuudised Medical News, where I approached evidence-based medicine and patient-centered care. So now I'm doing a little introduction, and the most interesting part is a patient's perspective, which I'm also going to talk about because I have actually two experiences with patients, my own and another experience of another patient. So I think this is very interesting and important. So this is all I'm going to talk about. The expert-centered care or specialist-centered care, it has different, it can be written differently. If you all see those, how it's written, then you know it's the same thing basically. And the other thing is patient-centered care, which I'm going to talk about because traditionally in psychiatry, it has all been expert-centered to this time, as we need innovations. Then I'm going to talk about evidence-based medicine and technology, and then experience of a patient. Psychiatry is a very important topic. 1 of 4 people in the world is affected by mental or neurological disorders in some point in their lives. Mental disorders have large impact on people's lives on every base. It affects work, life at home, communities. Experts think that that the combination of genetic and environmental factors causes personality disorders. Actually, life struggles can happen to anyone. As long as we have brain, we are not protected from mental illnesses. Rough childhood, traumas, bullying, social isolation all have an impact on mental health. And many difficult experiences can result in a psychiatric disorder. Upbringing is a very important factor which determines person's mental health. Due to rough upbringing, and also depending on the person's own nature, some genes contributing to mental illnesses can manifest. For example, when having a difficult childhood, one can develop depression, but some other person can develop bipolar disorder or borderline personality disorder or some other. For the majority of mental disorders, there are no biomarkers or technical tools that have been validated to determine diagnosis. The lack of useful indicators beyond checklist diagnostic criteria is one reason why mental disorders are often misdiagnosed, especially in initial presentation, particularly if diagnostic and treatment guidelines are not used systematically. Actually, 69% of patients with bipolar disorder are misdiagnosed initially by mental health specialists. About biomarkers, also it's important to test vitamin D levels, for example, but yeah. So we have to remember that mental disorders can happen to anyone, and we should treat patients as equals. So now I'm going to talk about traditional method in psychiatry, which has been there to this time and is still here. It's expert-centric. And it's actually not so easy for mental health practitioners also because they are required to undertake interviews to reach the most appropriate decisions for a possible diagnosis and treatment plan within short consultations. So they have not enough time. The number of specialized and general health workers dealing with mental health is grossly insufficient. As a result, very high caseloads and time pressure may contribute to lapses in history taking, potential medical errors, and unreliable treatment decisions. Doctors spend less time with patients and may not pay enough attention to data quality, diagnostic, and treatment reliability. Consultations are very short, so such time pressure may lead to lapses in the assessment process. In particular, not observing proper diagnostic and treatment guidelines raises risks. In contrast to any other medical area where diagnosing and treatment plan are based on highly sensitive and specific tests and technical innovations, psychiatry is still positioned as a medical art, in which initial clinical impressions that are made by professionals, usually during first interview or observation of a patient, often predetermine final decision in terms of diagnosis and treatment choice. But we have digital innovations bringing diagnostic and treatment standards into clinical practice and increasing patient-centered representatives' involvement in care plans. And this would transform current mental health services to be more patient-centric and assure the improvement of service quality via tracking systems following compliance with required clinical and psychosocial standards for patients' needs. So new technologies are required because traditional approaches struggle. And one is evidence-based medicine. It requires the ability to apply a knowledge of medical informatics, for example, efficiency searching the medical literature and clinical epidemiology to the treatment of individual patients. It has its evidence-based medicine has its origins from 1990s, where physicians would rely on the research literature rather than on textbooks or tradition when approaching patient care problems. Some claim that it's not so good, but contrary to the claims of some critics, clinical expertise continues to play an important role in evidence-based medicine also, as the clinician must integrate research evidence, patient preferences, and the patient's clinical condition in making decisions. So evidence-based medicine actually empowers clinicians to make their own decisions, guided by the best available evidence. And finally, evidence-based medicine considers patient preferences and encourages patient-centered care. So this is maybe the best figure for evidence-based medicine, in my own opinion, where you can see that it has patient values and expectations. Also, best external evidence is used and individual clinical expertise. And this all together is evidence-based medicine. So another novel method is person-centered care in psychiatry. This is a holistic approach within mental health care. Person-centeredness has been generally interpreted to convey a holistic approach with an attitude of respect for the individual and their unique experience and needs. It was evolved within primary care and has more recently become influential in thinking about mental health care delivery. So this approach is does not neglect patients' personal needs and concerns, and it does not weaken the doctor-patient relationship. The patient-centeredness remains. It has 5 key dimensions: a biopsychosocial perspective, an acknowledgement of the patient as a person, understanding the personal meaning for the illness for each individual patient, and sharing power and responsibility and sensitivity to patients' preferences for shared decision-making. So this person-centered medicine proposes the whole person and their context as the center and goal of clinical care and public health, and taking into account patients' values and health experiences. As well, also environmental and personal resources, quality of life, and other aspects of positive health, psychiatric and positive health. So it's actually a change in the style of interaction between patient and professional, from a paternalistic consultation style with a traditionally authoritarian and controlling doctor to one of more shared decision-making and empowerment of the patient. And at the heart of this lies the idea of striving to understand the whole person by listening to what the patient says and following up key cues that indicate that the nature of the problems might be, and responding empathically to their health. Also, research says that patient-centered style of consulting improves a wide range of patient outcomes. Also, in the context of chronic disease, it is well established that patients who actively share in making healthcare decisions have better health outcomes compared with those denied such opportunities. But still, person-centered medicine and personalized medicine do not yet have substantial bridges built between them, and this is something for the future. In conclusion, person-centered care contains the idea that diagnosis should cover not only disorders, but also disabilities, positive aspects of health, risk and protective factors, and the patient's values and experience on illness and health. So public expectations of mental health services and how they might interact with them are changing. Through greater use of technology, the public are becoming more engaged and better informed consumers of their own healthcare. It is believed by Dr. Maron and others that quality improvement in mental health services, including their ability to provide support and effectively complete their responsibilities for identification, prevention, and management of mental disorders, would significantly improve if the highest international standards and instruments oriented on achieving better outcome, health recovery, and human rights protection are digitalized and implemented in everyday practice. So existing approaches are there, digitalization, and we have apps, electronic health record systems, which can be used to integrate all these novel methods in psychiatry. So this is what I finished the last slide. The new concept contributing to more precise and personalized mental health care through the integration of IT innovations, digital phenotyping, genetic approaches, and cloud-based facilities and technologies should improve the management of mental disorders. Phenotype is a presentation of disease following a clinical evaluation. And it has huge benefits. The main benefit of such an approach is the expected shift of current traditional mental health practices towards preventive healthcare based on proactive assessment and screening programs combined with early intervention and treatment instead of reactive disease treatment. As a result, a reduced burden on patients, their social communities, and healthcare systems. Also, digital solutions have the potential to implement personalized medicine and genetic information, and this seems to be the future. Also, pharmacogenetic testing can be used as there are genetic factors in drug metabolism, as one person may benefit from one drug, another may not. Also, mental health strategies and interventions for treatment, prevention, and promotion must be based on scientific evidence and best practice. As a result, when this all is integrated, patient trusts the healthcare professional as he understands that the healthcare professional formulates patients' problems through medical literature. As patient himself does not have all the professional knowledge, but he knows that the professional has. This is a figure which can be used, and as I talked about tools and technology, there is a decision support system, which is called Documental. Yes. So this is the Documental system. It in the future may use genetics and everything else here. This is something healthcare professional uses, and it's personalized, it's patient-centric, and it has actually shown that Documental significantly improved and secured clinical workflow. We have also seen a higher diagnostic accuracy, guided treatment choice, and higher time effectiveness due to automated documentation and quicker overview. So it's automated. A healthcare professional doesn't have to take time to write on his own. That tool does that. So this is the Documental tool. It's for healthcare provider This is the first module. It's diagnostic module. It uses ICD-10 diagnostic criteria for all mental disorders. It also provides clinical presentation to treatment register, tracking medication choices, and management of care plans in a standardized way. Also, before patient's appointment, patient will be offered to complete a self-assessment questionnaire. This helps a healthcare professional to understand patient's problem and to achieve better results. So this tool has 3 modules. The first one is diagnostic module. It's structured ICD-10 diagnostic criteria for all mental health disorders. And the next module is treatment module. There are a whole list of psychotropic medications registered in the European Union for mental health disorders and operates by algorithms for medication and treatment plan selection, including doses and regimens in accordance with widely recognized treatment guidelines. And the final module is history and routine assessment module. So it's personal. So it's person-centered, and patient has all the results in their own electronic health record, which I'm going to show you soon. So now to the patient's experience. I'm going back to the beginning, as I stated that psychiatry is a very important field, and environmental factors can influence mental health as much as a personality disorder might develop. I myself have also experienced a better outcome when experiencing person-centered care and evidence-based medicine, and that brought me to this important subject. So that's why I'm talking here right now. Also, I have the permission to use very informative and interesting information about a patient who also received a lot better health outcome when experiencing patient-centered care. So this patient is a male patient, 33 years old, who agreed to share his mental health records here because he has both experienced expert-centric care before and then person-centric. As he had difficult childhood and external disturbing life experiences, he developed depressive disorder. And going to get some help, he also thought that there may be some personality disorder also. But personality disorder was not diagnosed, as psychiatrists didn't have enough tools and time. He was mistakenly misdiagnosed, thought to be autistic or some kind of other developmental disorder, which actually is something a person is born with. It is not acquired through upbringing, so it was misdiagnosed. As his depression had a deeper cause, which was from undiagnosed personality disorder, he tried therapy, but the real cause, underlying real cause for all his problems was hidden. Therapy actually did not help, and that led to even lower life quality, as patient felt that he was misunderstood in therapy and misunderstood during clinical evaluation and given the wrong medications. And one medication even made him aggressive. So it's actually very important to use tools from person-centric care. As patient was self-aware, so that's important. He thought that his impulsivity, which was acquired of external struggles, was due to a personality disorder, primarily borderline personality disorder. So patient turned to a patient-centered care. At first, before consultation, filled in a questionnaire. As I stated before, in Documental, a patient fills that questionnaire. It is very informative and helpful, and the psychiatrist has more time to talk to a patient, as some questions are answered before. Then during consultation, evidence-based medicine and using decision support system, in this case Documental, the patient was evaluated. Healthcare professionals started to evaluate patient using ICD-10. And when patient said that he suspects that he might have that borderline personality disorder, psychiatrist used F60 from ICD-10, and patient's own life experiences were also important as his own personality. Evaluation was very thorough. And this is in Estonia, of course, because it's in the patient's healthcare system. There are more. It's very thorough with this tool, and with objective findings, the evaluation was performed. All these traits were discovered when talking to a patient. And I should state that if a patient has enough traits, then he can be diagnosed. Of course, when a patient does not have enough traits of a personality disorder, this doesn't affect his life, then he does not have a personality disorder. So it's very important to analyze the patient if he has all these, and all these here written. So the evaluation and quantitative analysis is very thorough here. Thanks to all these, now healthcare professional was able to identify that the patient has a personality disorder, and mainly borderline personality disorder. So as you can see, person-centeredness was very important because his diagnosis was discovered, which was not discovered before, but it affected his own life. He made bad decisions. And also this documental tool, this evaluation technique is better for the healthcare professional, as they do not have to practice art, medical art, but of course they have all these objective findings, but they also have structure, and patient is actually listened to. So this information for the patient, he has them in electronic health record. Patient finds that information very helpful, because it's helpful for other healthcare providers. Missed diagnosis was actually discovered, and patient was prescribed a medication which was also helpful for his case. First medication that helped him, because before, when we had serotonin, this medication for depression, it didn't actually cure or help with his mental disorder, which was not discovered. The diagnosis was missed, and he was misdiagnosed as he actually was not perverse, didn't have autistic traits so much to be pervasive, as this is written here in Estonian. And this helped him tremendously. Also, healthcare professionals and patients, general practitioner, is able to see these results, and it is very helpful for them also. It is actually helpful to anyone, because it's science-based, informative, and actually a patient does not feel alone. As when the trait is written and it has a name, then it may help the patient with difficult feelings, when the patient may feel that he's alone with all those traits and nobody else knows what that feels like. Also, patient can show these results in therapy and start to work on them on a daily basis. This also is a strong basis, so a patient does not have the need to change doctors, who may all have their own expert-centric opinion. So this final result for the patient is person-centric, helps the patient, helps the other people. And as I used this patient's healthcare record here, I also experienced person-centered healthcare, and also my misdiagnosis was discovered, and I myself got the right medication, and it changed my life, because it was not discovered through expert-centric opinion. So I have 2 cases in my own life that the information for the patient and patient-centric care is so important and helps the patient. And yes, for the future, we should maybe need a technology where all this healthcare record is written somewhere, and patient can access it easily and read that when he needs that, maybe when he has problems in his own life, he can take that and read where that comes from. So these are person-centered care versus expert-centered care, which we should consider and use person-centered care more in the future, which relies on evidence-based medicine, as you saw. And traditional psychiatry, which is medical art, and the psychiatrists writes own things in the health record, it takes time, and we do not have that time. We need documenting tools like that was, because we have then more time. We do not need to write, we just check what do we have according to ICD-10 and use the patient's own opinion of what they do think they have. Also, it is clinician has his own opinion also. It's also very important. So, as I stated before, person who is evaluated by a healthcare professional is actually equal to us. So we cannot disregard his or her own life experiences. We as professionals should use all the available tools and evidence to form patients' problems into words objectively. Also in the future, genetic data is still in the future, not used on this day. I think I haven't seen that yet, but this would be very helpful, as right now when we are prescribing drugs, we have to wait and see how effective that drug is. But when we know the genetic individual pathways for that drug, this is actually more helpful. So this is all the references I used, and thank you very much.
Thank you, Helen. I don't know if you can see my screen, my video as well. I hope you can see me. So do we have any immediate questions to Helen at this stage? So you can either raise your hand or write your question in the chat. So I will perhaps start off myself and say that many thanks for a great presentation. So it was really nice to see how you opened up one of the main issues in the psychiatry, in my opinion, is that it's very difficult to diagnose because there are no detectable biomarkers that you could measure from any biological samples that you could draw from a person, their blood or from plasma or from other tissues. And it makes this, as you mentioned, it's a sort of like an art to try to figure out what is actually happening with the person. And this kind of structured approach that you showed is clearly very helpful for patients, also for doctors in the diagnosing of these diseases. So many thanks for that. So do we have any questions from the audience at this stage?
Yes, I would like that.
There seems to be none at this stage.
I would like to ask.
Yes, Davi, please.
So you talk about like full platform, but I think I missed how how the money transfers between the state funding Haigekassa and the service provider.
Could you write that question because I didn't hear correctly?
Okay.
Yes, thank you very much for that question. It actually, that Documental, it's patient has to pay for it, so it's not in Haigekassa doesn't pay for it, but it should. So yes.
But do you think that Haigekassa will in the future pay for it?
I hope so, because it's very important that patients are evaluated correctly, because the burden on the health system is actually very big, because patients do not trust psychiatrists. Psychiatrists have their own expert-based opinions, which patients do not agree. This patient changes doctors all the time. We have all those, like, patients cannot have even time for the psychiatrist. The queue is too long. So yes, it should be Haigekassa should pay for it and do something to take it into consideration, to use Documental maybe for every psychiatrist.
Tavi, I hope that was quite enough. Yeah. So one thing is, of course, the financial support from the financier, but I think the other aspect is also that the help that the patient receives is as accurate as possible, and that the patient does not have to go through an array of misdiagnoses and different treatments because of that. So in a way, there's one thing is of course the help for the system on general level, because every misdiagnosis also is a burden for the healthcare system. But in addition, it's a very big burden on patients as well. And as the overall or from that perspective, it's quite important as well.
Yes, I agree,
So
because
do we have
it was
any...
a burden. Sorry.
Sorry, I think I had a bad connection here. So was there
Yes.
another question?
I just wanted to state that, yes, it was a burden for, in my case, for a patient. He suffered for a long time, actually. And he himself, he knew in his heart maybe that he may have some kind of personality disorder, but through expert-centric evaluation, that was not discovered because he was not listened to.
Right. It makes sense. Do we have additional questions? Do you have any other comments to Helen and this approach that we just saw? If not, then I would thank Helen for... Yes, Tavi, please.
I would ask again, what do you think if the patient has to pay, is it maybe monthly subscription the best choice?
I'm so sorry. It's so difficult to hear you. Can you write that again? I'm so sorry for that.
If the patient has to pay, is the monthly subscription the best choice?
I don't actually think so right now, but my opinion may change when I have some new information. But right now, I don't think that, because a patient pays for the first consultation. It was maybe 80 euros. I don't remember actually. And then other consultations are not that high priced because they take only 15 minutes of the psychiatrist's time. And patient does not always need that consultation. Patient has all that records stated there in e-health, and he can see them. Other psychiatrists can see them. So it's just a patient got a right diagnosis, and then he starts to work on himself through maybe other psychiatrists or something, and this all reduces burden on healthcare system.
I'll ask again, but in the system, if you look at the system right now, in certain regions, there is only one psychiatrist. So if they need a second opinion or the third opinion, they cannot really get it in their hometown. So is it okay for them to use this platform as a second opinion, or is it okay for them to go to another city to another doctor?
It's a very great question. Documental platform is it's web-based, so a patient can ask an opinion everywhere through internet, and there are many doctors there. There is yes, there are many doctors. You can use you can have an other expert opinion with that tool again on the same documental basis.
Tavi, I hope that was a sufficient reply to you. Do we have additional questions? Any other comments at this stage? If not, then I would thank Helen for presenting about patient-centered psychiatry, which is a very interesting approach. Looking forward to hearing more about it in the near future. And also want to thank the audience for taking part in this webinar. Wishing you best of luck for the end of Friday, and also have a great weekend. Cheers.